If you've ever been told your creatinine levels are high, you know that sinking feeling. It usually means your kidneys aren't working as well as they should, maybe from chronic kidney disease or even sudden damage. But what if I told you there's some real buzz around stem cells as a potential game changer for kidney problems? Here's what's up. Recent studies suggest that mesenchymal stem cells, those incredible little builders found in bone marrow, fat, or even umbilical cord blood, might actually help damaged kidneys heal. These stem cells are like the emergency responders of your body. They rush to the scene, release special growth factors, and help calm down inflammation, potentially giving your kidneys a chance to recover. So if stem cell treatment is on the table, what does it actually look like? First, your kidney function gets a full checkup. Creatinine, GFR, the works. Doctors check what's causing the problem and see what other health issues you might have. Then they choose the right type of stem cells, sometimes from your own body, sometimes from a donor, depending on what's best for you. The cells are usually given through an IV, though sometimes they go directly into your kidney area if needed. Dosage? About 1.5 million cells for every kilogram you weigh, usually once or twice a week, and the process is repeated about 8 times. Afterwards, your kidney numbers, creatinine, BUN, and GFR, are closely monitored. Doctors also keep a sharp eye out for any side effects, infections, or immune reactions. Managing your blood pressure, blood sugar, diet, and water intake is just as important too. So, is stem cell therapy hope or hype? Well, the research is promising, but it's still early days. If you're curious, talk openly with your kidney specialist. They'll help you weigh the risks and rewards for your unique situation. Stay hopeful, stay informed.